Maryland Hair Restoration offers the newest, most advanced, and least invasive option available for hair restoration in D.C., Maryland, and Virginia. And Dr. Stephen Parker from the Parker Medical Group is here to talk about the benefits of his special NeoGraft procedure. So welcome, Dr. Parker.
Thank you.
How
nice
you doing?
To be here. Fine, thanks.
Okay, so I got to ask, when you think about hair restoration, back in the day, it was plugs. And, I know a couple of guys who've had the hair plugs, but that's all different now, thanks to you and your practice. And there's a unique procedure that you do.
Yeah, so the plug method is very outdated. The problem there was that the hairs were not separated into follicles that have 1, 2, 3, or 4 hairs. They were all put together.
Okay.
If you put follicles that have 3 and 4 hairs up front, you'll get a doll-like, plug-like look.
Okay.
And so it was obvious that a person had a hair transplant. Now that's old technology, and the next method was the strip method, where a long incision is made in the back of the scalp and cuts out a piece of scalp, which is then sewed together or stapled together. The problem there is you are left with a permanent linear scar. And when you have that strip, you then dissect out the follicles, and they are separated into how many hairs they have and place, so the result can be very nice, but again, it leaves you with a permanent scar.
So what does your procedure do?
Yes, so our procedure is called FUE, or follicular unit extraction, as opposed to strip, which is FUT, follicular unit transfer. We use a NeoGraft machine which facilitates the harvesting of the grafts. First, we shave the back of the head, and then with our NeoGraft machine, we go right over the follicle and extract follicle by follicle, so there's no linear scar. When the hair grows back, you don't know we were back there.
Okay.
Now, with the NeoGraft, which is automated FUE, the NeoGraft machine allows us to dramatically increase the speed at which we can take out these follicles, and also the accuracy by which we can pull out these follicles. So we can do many more grafts than we could in a previous method, which was manually. This is now automated, and so we can do we can do in one session a large amount of coverage that might have taken 2 or 3 separate sessions doing it manually.
So the results are quicker and there's a more immediate showing and a look that comes about this, right?
Well, the big advantages of our method are, again, no large incision, no permanent scar, a quicker recovery, less pain. There's with the strip method, there's more chance of numbing, bleeding, a feeling of scalp tightness.
Right.
We eliminate that.
So from start to finish, and I guess it would depend on how big of an area that you're trying to restore the hair, but let's just say right here in the center, from start to finish, how long would that typically take?
Probably you'd come in at 9 o'clock and, let's say, leave anywhere from 2 to 5, depending on how large the area. So it's a long day. It's done under local anesthesia.
Okay.
There's a little bit of sedation by mouth in the beginning, just to make the day go a little faster. Then it's done under local anesthesia. And the recovery is very smooth. There's very little pain. Now, in both methods, strip or the NeoGraft method, it does take a while for the hair to grow, and we start seeing results in about 3 months, and then the full result usually about 12 months. But it's a permanent result, very natural looking, and
of course, because it's your hair.
Right.
Yeah.
That's right.
Quickly, do you also help women who may have thinning hair?
Yes, we do. Now, women have a different pattern of baldness. Men's tends to be more focal. It might be the crown, it might be a receding hairline, where women have a more generalized area really across
Dr. Parker, I'm sorry I got to cut you off right now, but thank you for coming in today.
You're welcome. It's a pleasure.
Thank you so much.